All right, our top story at this hour. Northwest Health MEC Madoda Sambatha is about to release a preliminary report into the probe on the placing of babies put into cardboard boxes instead of cribs and incubators at the Mahikeng Provincial Hospital. On that note, we're going to cross to our reporter Tebogo, Phakedi, who's standing by for us. Tebogo, good afternoon. Thank you for your time. Obviously, we are awaiting the announcement by the Northwest Health MEC. Perhaps you can take us through what the expectations are ahead of the briefing that's set to take place in just a few moments.
Most definitely, good afternoon to you and of course to the viewers. Yes, as you have rightfully stated, MEC of Health in the province, Madoda Sambatha, is expected to release a preliminary report just in a few minutes. He met with unions earlier on and he's now with different nurses, addressing different nurses here at the Mahikeng Provincial Hospital. Thereafter, it will be a media briefing where he will be releasing the report, making it public. Of course, this comes after just on Saturday when we understand that there was an incident where babies were put in boxes. I can tell you that we know that during that day, 56 babies were delivered. This is a ward with 25 mothers' capacity, meaning they took more than they could, manage at that particular time. And we understand that out of 56 babies, 47 were in cribs or incubators, meaning just 9 had no incubators or a crib. That is when we saw pictures of 4 babies placed in, card boxes. We understand that the remaining 5 had to share a crib with the other babies. And of course, these pictures circulating on social media, of course, receiving different views. We later saw the MEC then writing a letter to the Minister of Health and the Premier of the province indicating that investigations will unfold and the nursing manager and the one alleged to have, been the one putting those babies in that particular card boxes will be on precautionary suspension. On Monday, we saw nurses and unions in a peaceful demonstration against any possible suspensions of these nurses, saying they had to improvise. There's nothing they could do at that particular time, citing to lack of infrastructure here at the hospital, something that the MEC of Health, Madoda Sambatha, has also admitted that as far as the infrastructure is concerned here at the Mahikeng Provincial Hospital, it is actually a challenge. We understand that just over the weekend, he then sent more cribs to the hospitals, but this is a story of what nurses come across on daily basis, saying this provincial hospital will be admitting mothers, and you would understand that some are transferred from different clinics, some even, over 100 kilometers from Mahikeng. This is a provincial hospital, yet there are no resources at all. And now with the unions, the expectations, as you have asked, is that there should be a long-term plan to ensure that what transpired does not happen again, to ensure that the, nurses work in a conducive environment where there is equipment, where patients also can receive proper health care. This is the stance here in the Northwest, where we are awaiting the MEC of Health to release that preliminary report. We understand that the nurses that were said to, that were expected to be suspended are reporting to duty, as the unions indicated that they do not want any suspension. The MEC had a walkabout just a day before yesterday, where he was with unions to do oversight, check the situation here at the Northwest, that is Mahikeng Provincial Hospitals, with of course other parties, even the health portfolio committee in the legislature also, showing, saying they are quite disappointed that after so many times that the committee was here doing oversight, the situation has not improved at all. But we will hear what the report says as far as the investigations are concerned, and if there'll be any recommendations. Is the MEC sticking to his point that someone has to account? While the MEC says the CEO and the nursing manager should have been aware that there is no, there's a shortage of cribs and incubators. Others are saying who is supposed to be held liable because they are the ones who should be procuring all this machinery.
About resources or insufficient resources at the hospital at this point, can you just confirm whether additional resources has been provided by the Provincial Department of Health at this point to cater to the shortage of incubators and cribs? What's the improvement plan since Saturday that has been put in place? Perhaps mitigating against shortage of electricity, even a leadership issue as well.
The MEC says about 18 cribs were sent to the hospital. We spoke to unions. Some were saying they haven't seen incubators because the other challenge is that of incubators. As you would understand, it's quite a need when you look at the neonatal ward. But we understand that there hasn't been any incubator sent to the hospital. The MEC says he sent quite a number of cribs following that incident. That is a word from the MEC. We have not been allowed to go inside the wards, and the unions have not been able to confirm if that is the case. But we will see if the MEC further promises to do something about this insufficient, resources in this hospital.
We're obviously awaiting that preliminary report to be released by the Northwest Health MEC Madoda Sambatha. This is obviously following the probe into the placement of babies in boxes at the Mahikeng Hospital. Tebogo Phakedi is going to be bringing us the latest as that briefing gets underway.